Welcome to the deep dive. We take complex information, sort of break it down, and pull out what you really need to know.
That's the plan.
And today, we're tackling something, well, absolutely fundamental if you're going into nursing.
Right.
It's all about how computers and healthcare informatics are totally changing collaboration and, best practices in patient care.
Exactly. Think of it as understanding the tech foundations of modern healthcare. Essential stuff for your future practice.
We're drawing mainly from Nursing Informatics and the Foundation of Knowledge, chapters 5, 6, and 14, pulling out the key insights.
And our mission today, basically to show you how this technology makes teamwork smoother, helps you use evidence in your care, and yeah, ultimately leads to better, safer patient outcomes.
Okay, let's dive into that. Collaboration. I mean, it used to be face-to-face, maybe some phone calls.
Right, maybe paging someone.
Yeah. Now it feels like computers are like the central hub connecting everyone.
That's a great way to put it. They really are like the hospital's central nervous system. They
Right.
collect so much patient data, vital signs, lab results, doctor's notes, you name it.
And they store it.
Store it securely, yeah.
Yeah.
And crucially, share it across different departments. That's the real game changer for interdisciplinary teams. Everyone working on the same patient needs that shared view.
So the electronic health record, the EHR,
Mm-hmm.
that's the big one, right? How does that specifically help different disciplines work together?
The EHR is basically the patient's comprehensive digital story, all in one place.
Okay.
So, as a nurse, you can instantly see the latest labs the doctor ordered. A physical therapist can check your notes on how the patient's moving. The case manager sees the whole plan.
So it breaks down those old information silos.
Totally. It fosters much, much better communication. Think about, say, an alert popping up because a new drug prescribed by a specialist might interact badly with something the patient's already taking.
Right. Hard to track with paper charts.
Incredibly difficult. The EHR makes that visible to the whole team, potentially.
So it's not just having the data, it's making it usable, actionable for everyone caring for the patient.
Exactly. We're all knowledge workers in healthcare, really. We take complex data, turn it into smart decisions.
Right.
And informatics tools, well, they help organize and present that data clearly. So it supports evidence-based practice and makes team decisions, more solid.
Quality improves when everyone's on the same page looking at the same clear information.
That's the idea, definitely.
Okay, and I've heard about decision support systems, DSS, inside the EHRs. What do they actually do for the team?
Oh, these are invaluable. They're integrated right in. They analyze patient data, like in real time.
Okay.
And they can give alerts, reminders, even suggestions based on that specific patient.
Like what? Give me an example.
Okay, it might remind you a medication is due,
Yeah.
or flag a critical change in vital signs, or even suggest a specific nursing action based on best practice guidelines for that patient's condition, say sepsis protocols.
Wow. So it's like a built-in safety net or guide.
Kind of, yeah, an extra layer of safety. It helps keep care consistent and aligned with the evidence.
That makes sense. Now, patients move around a lot, right? Hospital to rehab, home care. How does informatics help with that?
That's where EHR interoperability is key. It's the ability for different providers, different systems, maybe in different facilities, to securely share patient info electronically.
Okay, so the information follows the patient.
Ideally, yes. It's absolutely critical for smooth transitions. Think about discharge from hospital to, say, a rehab facility.
Yeah.
If the rehab nurses can easily see the hospital records, meds, allergies, what happened during the stay, it cuts down on errors massively. Makes for a much safer, smoother recovery.
Huge difference. Okay, and what about reaching specialists or collaborating when people aren't physically together? Telehealth.
Oh, telehealth has become huge, hasn't it? Especially for remote consultations or even just team meetings when geography is a barrier.
Like for rural patients.
Exactly. Or connecting a rural clinic with a city specialist. And we saw its power during the pandemic, right? Teams could still collaborate effectively even when they couldn't meet in person.
Right. It really expands who can be part of the care team, regardless of location.
Okay, switching back inside the hospital, what about the systems nurses use day to day?
You're probably thinking of clinical information systems, or CIS. They're the backbone for daily collaboration within a facility.
Okay.
They support things like collaborative order entry, where different team members can see and add to patient orders. Medication reconciliation, super important for catching errors when care transitions.
Like admission or discharge.
Exactly. And just real-time documentation. Everyone needs to see the latest updates on the patient's status and the care plan.
So a nurse documents a wound change.
And boom, the physician or therapist can see it immediately in the CIS.
Got it. And if a patient's condition changes suddenly, how do nurses get the word out quickly?
That's where integrated team communication tools come in.
Mm.
Secure messaging platforms are a big one.
Like texting, but secure. Basically, yeah. Secure messaging, patient portals for communicating with patients and families too, sometimes, and collaborative dashboards showing real-time data.
So a nurse sees something concerning.
They can send a secure message right to the doctor about, say, worsening respiratory status, gets a faster response, quicker adjustments to care. That real-time link is vital.
It sounds like all this data must be useful for learning from mistakes too, right? Preventing future problems.
Absolutely. Informatics is crucial for root cause analysis, RCA. When something unexpected happens, an adverse event,
Yeah.
these systems let you pull together data from all over med records, vital signs, nursing notes to figure out if there were underlying system issues, not just blaming individuals.
Okay, so looking for patterns or flaws in the process.
Exactly. And that helps the team understand what really went wrong and make changes to stop it from happening again. But it needs team input, definitely. The tech finds the data, the people provide the context.
Right, the human element is still key.
Always.
Yeah.
And looking bigger picture, all this data drives quality improvement. Teams use dashboards, benchmarking tools.
To see how they're doing.
Yeah, monitor patient outcomes against standards, see where they're doing well, where they need to improve, and then they can work together to adjust care processes based on that data.
Okay, that makes a lot of sense. So we've covered how computers help teams work together. Now let's shift focus a bit. How does all this information in tech actually inform the best practices nurses use every day?
Right. A really core idea here is the foundation of knowledge model.
Okay.
It basically describes how nurses turn raw patient data, like, say, a pain score of 8 out of 10,
Uh-huh.
into meaningful information, maybe noticing, the pain always spikes after they walk.
Right, finding a pattern.
Exactly. Then you combine that information with your clinical experience, your nursing knowledge, and you develop knowledge about that specific patient's pain and what actually works for them.
And that knowledge guides what you do next.
Precisely. It informs your practice, leading to better outcomes. And informatics tools help at every single step, getting accurate data, presenting the information clearly, supporting that knowledge development.
So it's like a continuous cycle of learning and improving care. How do tools help nurses apply the latest evidence to guidelines?
Well, they can build clinical practice guidelines right into the workflow.
Oh, okay. How?
So maybe you're assessing a patient for pressure ulcer risk. The EHR might pop up the latest evidence-based prevention strategies, reminding you about repositioning schedules, specific skin assessments, things like that.
So you don't have to rely just on memory, especially when things are busy.
Exactly. It helps make sure care is consistent and follows the most current recommendations.
That sounds really practical. We mentioned clinical decision support, CDS, earlier. Can you give another bedside example of how that helps with best practices?
Sure. Allergies are a great example. Patient gets admitted, you enter their allergies into the EHR. That CDS system is now constantly scanning everything, order meds, treatments, even diet trays against that allergy list.
Ah.
If there's a potential conflict, like a doctor orders a drug that the patient is allergic to, bam, an alert goes to the nurse, the doctor, whoever needs to know. It prevents a potentially serious error.
That's huge.
Or it might calculate a fall risk score based on your assessment data and prompt you to implement specific fall precautions for that patient. It aligns your actions directly with safety best practices.
So it's giving that real-time, patient-specific guidance. What about nursing documentation itself? How has tech changed that regarding best practices?
Modern nursing documentation systems often use structured templates.
Instead of just free text.
There's still room for narrative, but templates guide you to cover all the essential assessment points, care planning elements, interventions in a standardized way.
Okay. Why is standardization important there?
Well, it ensures consistency. Everyone captures the key info, shift to shift, nurse to nurse. It improves communication, definitely. But it also makes it much easier to track patient outcomes over time and spot trends.
Like tracking wound healing.
Perfect example. Standardized wound assessment templates mean everyone measures and describes the wound the same way, so you can objectively see if it's getting better or worse.
Right. And all this detailed data, that leads to this idea of data-driven practice, right? What does that mean for nurses?
It means you can actually use the data collected in the CIS or EHR to see what's working best.
Oh.
You could say, look at outcomes for patients with similar conditions who receive different nursing approaches for managing anxiety, for instance. The data might show which interventions consistently lead to better results in your specific patient population.
Ah, so you use your own hospital's data to refine care.
Exactly. It's using real-world evidence generated right there to optimize nursing interventions. It's like leveraging the collective experience.
That's powerful. The collective experience, captured in data, improving individual care.
That's a good way to put it. And informatics is also vital for tracking and reporting quality metrics.
Things like infection rates.
Yep. Nursing sensitive indicators like hospital acquired infections, pressure injuries, patient falls. Systems can often generate these reports automatically.
And that helps identify problems.
Identify trends, yeah. See where outcomes aren't meeting the benchmarks. Then the organization can make targeted changes in nursing practice or protocols to try and improve things.
Which brings us to protocols and pathways built into the EHR. How does the tech help nurses actually follow these guidelines?
Think of protocols like for sepsis or stroke or care pathways for heart failure as evidence-based roadmaps.
Step by step.
Pretty much. And they're often embedded right in the EHR. So for a sepsis protocol, the system might prompt the nurse at each critical step assessment items, required labs, timely interventions, making sure nothing gets missed in that time-sensitive situation.
So the tech helps ensure the best practice is followed consistently and on time.
Exactly. It guides the nurse through the key steps based on the evidence.
You know, listening to all this, informatics isn't just about, charting faster. It seems fundamental to how nurses learn and stay current, too.
Oh, completely. It's transforming nursing education and continuing professional development.
How so?
Well, simulation technology is getting incredibly sophisticated. You can practice complex scenarios in a safe virtual environment. E-learning platforms, online CE modules, they make it so much easier and more flexible to keep up with new research and best practices.
Wow. It really is woven into everything, isn't it?
Yeah.
Way beyond just typing notes. It's about teamwork, smarter decisions, safer care.
That really is the heart of it. Using technology and data to enhance pretty much every part of nursing practice, collaboration, decision-making, implementing evidence at the bedside.
So, for all you future nurses listening, hopefully this deep dive makes it clear just how crucial understanding these informatics concepts really is. It's not just IT stuff. It's central to how you'll work and provide the best care you possibly can.
Absolutely. This knowledge is foundational now. It helps you navigate modern healthcare, be an effective team member, and keep improving your skills using all this information that's available.
So, final thought as you move forward in your studies. Think about this. Technology is moving so fast. What's next? How else do you see informatics shaping nursing and patient care in the future?
Yeah. And how will you personally use these tools and maybe even help develop the next advancements?
Definitely something to ponder. Thanks for joining us for this deep dive.